A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors. What is the role of the primary care physician, your family physician? Back in the day, they would come to your home to see if you were sick, but things have changed significantly. Primary care physicians are not only there to treat your illnesses, but also to work with you and your family. They conduct wellness tests and review your history. Find out what you should ask your doctor and why on this edition of your Hometown Health Connection. I'm John DeSciullo. Joining us is Dr. Richard Charles, Chief Medical Officer for General Physician PC, one of the largest medical groups in our Western New York area, a collective of the region's most well-respected, accomplished healthcare providers from many different areas of medicine, from general practitioners to highly skilled specialists. Dr. Charles is also the current chair of the Physician Leadership Board for Optimum Physician Alliance, a physician who is board certified in internal medicine. Dr. Charles has been in practice for more than 20 years. He graduated from UB Medical School, summa cum laude, where he also completed his residences, and prior to that, earned a Bachelor of Science degree in pharmacy. Dr. Charles has been at the forefront in leading many of the organizational and quality initiatives at General Physician PC, and says his ultimate goal is to improve the health of all Western New Yorkers. An active community member and entrepreneur, Dr. Charles also owns several Dairy Queens. So, Dr. Charles, thank you very much for being on the show today. It is amazing because just before we started recording, you have such an energy about you. And, you know, the general physician over the years, that role has changed. You know, we talked about the old days where the doc would go to the house, imagine that. But why is it so important for somebody to connect with the general physician? How do you see that relationship with the patient?
I think your relationship with your primary care provider is a critical piece of the overall collaboration of your health care. Today, there are so many complexities and different areas that you receive care or interact in the care environment. And to maximize your clinical care, it's important that you have a primary care provider who can help you in that interaction, not only with your general health screenings, lab work, testing, your interaction with subspecialty care. You know, at General Physician, we have the opportunity to have many incredibly competent practitioners in specialties such as cardiology, and it allows us to interact in that environment with the specialists, but also to interact with other things that affect your care, the so-called social determinants. How do you collaborate everything that goes on? So for a patient that experiences the healthcare system as an inpatient, how does that transition occur from being a patient in the community to being hospitalized? And then after the hospitalization, how do you collaborate all the things that need to happen? Home nursing, maybe a subacute rehab stay. One of the things that General Physician has tried to do is to clinically integrate that within the Great Lakes Integrated Network and really to provide a health home for the patient. So how do you meet all of these many needs, some medical, some social, some
psychological, I would think, too.
Exactly.
Yeah.
And that's the key, is how do you interact with your doctor to make sure that they're engaged, that they're part of your care team, and overall managing that, helping you manage as a collaborative partner.
Do you feel that you have to know, as a general physician, a little bit about a lot of things, but then at the same time, you're also taking tests and, as you mentioned, giving people the guidance on where to go for the specialty? What kind of tests should people get when they go to see their general physician?
Absolutely, and I think one of the key things as a patient is when you go to see your doctor, everybody has things that they want to accomplish. I want to make sure that you've had your screenings, colon cancer, breast cancer, prostate screening, vaccinations. But as a patient, you have concerns. Maybe it's a rash, maybe it's an ache or a pain, but the real interaction with the doctor should focus on what is your agenda, what is your list. Have a list. What needs do you have that may not be medical, but maybe you want to understand how I get some help at home. Maybe I need a new walker, maybe I need some home physical therapy. Maybe I want to go see an ophthalmologist or a cardiologist or an orthopedic surgeon. What drives that choice? Is it access? You know, well, how do you make sure that you see the best doctor? Because everybody has family or friends that have seen a doctor or a specialist. How do you make those choices? It should be a discussion you have with your doctor. You know, why do you send me to Dr. X? What do you recommend to make sure that I have the appropriate oversight at home if I'm aging or I'm debilitated? What lab tests should I ask? How often should you have them?
Right. And what lab tests should you get?
It's age-based. So if you're, cholesterol levels, if you have other medical problems like diabetes and high blood pressure, what is your kidney function? What does your urine specimen look like? Is there protein? So a lot of it depends on what are your medical conditions. How old are you? There's many lab tests that are dependent on that. There's many screenings, colon, breast, that are related to your age and your risk. What's your family history? Critical in an interaction with your doctor.
It's so many things to be aware of. And I would think, just kind of going through kind of a tick list here of things, you've got a rise now in high blood pressure. Buffalo Healthy Living magazine put these together, hypertension, type 2 diabetes, and obesity. So how much of that are you seeing in your practice?
There's absolutely an enormous amount of that. If you look at the statistics that have been available for a long time, not only are those a big issue, so are obstructive lung or asthma issues. And really, when you go to see your doctor, you should ask, am I at risk? Do I have high blood pressure? Do I have high cholesterol? Do I have diabetes? Do I have some kidney issues that we should worry about? As we age, everything tends to start to slowly decline.
Right.
Your breathing status, your cardiac status, your kidney status. How does that impact, doctor, what drugs you prescribe me? And so these are interactive questions that you should be asking. If you get prescribed a drug, make sure that the doctor has considered whether you have diabetes, whether you have kidney disease, because one of the big things that we see in patients that are hospitalized is that some of the reasons that people get sick are related to medications, not recognizing things that need to be addressed. So you really need to be an advocate for yourself, but also work collaboratively with your doctor to make sure that at the right tests, the right referrals, and the right everything else. In other words, what's going on with your exercise. You mentioned these three huge conditions: diabetes, high blood pressure, and high cholesterol, and heart disease. But what are we doing beyond prescribing medicine and ordering tests? Are we giving people prescriptions for exercise? What are we doing around nutritional things? And that's really how, as a primary care provider, I think we most advantage our patients, by helping them throughout the whole care system. Because you're not just a blood pressure of 130/80, you're that plus everything else that goes into your care.
When someone does go to the doctor, that we're used to getting that, that armband and pumps it right up, you feel like your muscles are really ripped. But how important and why is that blood pressure test so key? What do you find out with that?
Well, you find out a lot. You find out really a bit about the window of vascular health. Is that number high? If that number is high, it could suggest that you're at risk for stroke, kidney disease, heart disease. So it's really important that it be measured correctly. You should be sitting for a few minutes before it's done with your back and arms supported. It should be done not just when you walk in from the waiting room and you're nervous. The doctor or the nurse should take it after you've sat for a few minutes. I think it's critical that it be done correctly, but you want to know what your number should be. What is my target, right? It's the same with cholesterol.
What is a good high blood pressure?
Well, that's exactly right. So there's guidelines. The American Heart Association, American College of Cardiology have established guidelines. So a normal blood pressure is considered under 120/80. Over 130/80 is considered high. We used to use numbers like 140/90, for a brief time 160/90, but it also varies based on your medical conditions. You bring up diabetes, you bring up heart disease and stroke. The guidelines tend to be a bit more aggressive there, because we know the higher your blood pressure gets, the more at risk you are for complications.
How important, you talked about family history. My late mother had some health issues and had a weight issue, and diabetes was there. How important is that family history when you look at somebody, whether it's diabetes or kidney disease, like you mentioned, heart conditions, and how do you monitor that? And is it always the case that if somebody in their family had a certain medical malady, that it would translate down in generations? Is that always the case, or does it sometimes, I hear it skips over? Interesting, that genealogy.
That's a great point, and I think family history is incredibly important. You mentioned again these three big things, heart disease, stroke, diabetes, high blood pressure. Those are very much correlate to your family history. Many cancers are. So it totally changes your screening algorithm for colon cancer or even breast cancer. If you have a family history, you have to be much more in tune to that. So I think family history is incredibly important, because we are where we come from. And certainly family history is a major determinant of the medical conditions we're at risk for. So if you have a family history of diabetes, maybe you really do need to focus on exercise a bit more, or diet. You know, we're not all equal in that regard. So I think family history is a very unrecognized issue. Cancer, heart disease, stroke, diabetes, high blood pressure, all these things are related. And even some of the more unusual genetic conditions. But I think that's a situation that you should make sure your doctor is aware that you have a family history of colon cancer, of diabetes,
right,
because it does affect how we screen for those.
Let's, in our about 3 more minutes left, Doc, in our first segment here, but let's talk about diet and exercise. Let's kind of combine those, because, you know, when I was growing up, you know, you had a certain regimen of, you know, if you had a headache, you took some medicine, if you had an issue. But now it seems like the diet and what goes into your body is as much a part of that healing process. And even though we're so health conscious, there are some things about Western New York that maybe are not with some of the foods we like. And I would suspect the older you get, the more acute that becomes. So let's combine that diet and exercise.
Absolutely, and I think it's a critical thing, right? So I think when you look at all these problems we're talking about, right, if you wait to develop a problem such as diabetes and high blood pressure that requires medication, if you wait to address that till it becomes a critical problem, you really disadvantage your future health. So focusing on exercise, moving 30 minutes a day, making sure that you're doing things that allow you to maintain muscle mass. If you're older, it helps improve your balance. It's been associated with better cognitive function. Diet is critical, right? You hear so many different diets that people are on. You know, there was Atkins, and then there was low fat Atkins diets, and then there was low carb diets. Now you'll hear people talk about keto. In my mind, what you see now is people focusing more on plant-based diets, healthier diets that are focused on balance. And I think as you look at diet and exercise, it is a critical piece in maintaining your health and well-being. And I think moving forward, how we collaborate as a healthcare provider, addressing all these lab tests and screening, to what is your nutritional plan? What is your exercise plan? Do you have an exercise prescription? I think those things are all part of your primary care provider's job.
But don't you think that it's a lifestyle change too? Like when people say you have to go on a diet, they look at it as well, I start here and I end here, and then I go back to the way it used to be. It's maybe not necessarily the case.
I think it's exactly what you just said. I think that's really over the target. It's lifestyle. What is your lifestyle around exercise, around diet? You have to make that just part of what you do every day. You eat the right combination of fruits and vegetables and proteins. You get your 30 minutes of movement in. You make sure you get enough rest. Your health and well-being is so determined on all the things that aren't medication, that aren't surgical procedures, that aren't lab tests, but it's really your overall health and well-being that your primary care provider should be thinking about and asking. You know, there's all these questions that you want to ask in the time you're with your doctor. He has questions he needs to ask around these issues as well.
Dr. Richard Charles is with us on your Hometown Health Connection. We're going to be back right after this. We will have much more with Dr. Richard Charles, Chief Medical Officer for General Physician PC, specializing in primary care and internal medicine, with offices located at 1091 Main Street, Suite 301 in Buffalo, 705 Maple Road, Suite 300 in Williamsville, and 5959 Big Tree Road, Suite 102 in Orchard Park. Here's the phone number to call. It's area code 716-248-1420. Write that down. 248-1420, and online at gppconline.com. We'll be right back. Buffalo Healthy Living Magazine is a free, full-color magazine distributed throughout Western New York. Now, more than ever, as we all want our families and friends to be safe and well, Buffalo Healthy Living Magazine is devoted to health, fitness, and nutrition for people of all ages. It's a great read and also has great recipes. Pick up Buffalo Healthy Living Magazine all over our hometown or go online anytime at buffalohealthyliving.com. Welcome back to your Hometown Health Connection. We're talking with Dr. Richard Charles from General Physician PC. And Doc, we talked a little bit in the last segment about diet and nutrition. And before we recorded our program, you and Annette Pinder from Buffalo Healthy Living and I were meeting, and you shared an interesting personal story. I'd like you to share that with our viewers.
Absolutely. So when I was about 13, I was about 260 pounds. and I decided I needed to really change my lifestyle, and I wanted to play high school athletics, and so I really focused on exercise and diet, and that has maintained throughout my adult life. And really I focus on making sure that I get enough exercise and eat properly so that I can maintain my health, so that I can help the community. And I really view what goes on in your primary care doctor's office as a collaboration. It's not only the tests that I order, the blood pressures I take, but how do I help patients who are diabetic or hypertensive? How do they manage their nutritional needs? How do you make sure that they're seeing a nutritionist and know what the right healthy eating choices are? Nutrition is critical, plant-based, balanced. And then also, what is their exercise prescription? How do they work with their trainers? And how do you make all those pieces understand what the other is doing? And I think as a primary care provider, what's going to move forward with the technology that's available is how do you collaborate all that? And how do you work to improve the overall health of your condition through these three critical pieces: what the primary care doctor is doing medically, what the nutrition is, and also where the exercise goes.
In the last year, we've been deluged with all kinds of medical information, as a result of the pandemic, and we're moving forward now. But so many people, I would think, came to their doctors because they were concerned about their health. How many times should a person see their primary care physician?
It's an awesome question. And I think what the pandemic did is it focused a lot of people who don't necessarily access care on what do I do in that regard. And I think generally reaching out and seeing your doctor on an annual basis is critical. Why? Because you can then reassess where you are. What tests should I order? You pointed that out earlier. What should my exercise routine be? What should I do around nutrition? What are my goals? What are my health goals, both myself, and what is your doctor's goals, looking at all the available data in the medical world? And you're exactly right. During the pandemic, people came to the doctor that hadn't previously gone around concerns around maybe COVID, but then maybe that allows them to access care. Maybe somebody in their 50s who wouldn't normally go to the doctor. Men like you and I are terrible about going to the doctor.
Terrible.
Terrible.
Doc, I hadn't seen my primary care physician in 10 years.
10 years.
Until my daughter got on my case and said, "Dad, you got to go. You're almost 60. You're not a kid anymore." And they found out I had some pretty high cholesterol, and I'd consider myself a pretty healthy guy.
Absolutely, because you are, as we talked earlier, about some of your genetics, right? And so maybe you eat very well and you exercise, but you have terrible genetics in that regard. And maybe the concern needs to be, you look at the atherosclerotic risk factor equation to see what is your risk of vascular disease in the next 10 years. And even if you eat well and you diet, but the number is high, well then what else should you be doing? Should you be considering medication? Should you reevaluate where you are from a lifestyle or from a exercise perspective? I too reassessed my own health. I went and had a colonoscopy, and it turned out that it was critical for my future health and well-being. And I think that's what it's really about. So you ask the interval. I think a year is great. But I also think going back to when you go to see the doctor, what is your checklist? We all get a lot of information, but you'll see that many of the insurers, many of the primary care offices, ours included, will say, this is what we think you should be doing. Breast screening, colon screening, screening for diabetes, screening for cholesterol. Right. And I think really having an idea of what you should be doing when, it's no different than maintenance in your car, right? You take your car in and you get an oil change, you rotate the tires. We should be doing that every year ourselves.
Why is it sometimes, and it's not just men, although I guess sometimes maybe, I'm the dolt that didn't do it, but I hear that sometimes men tend to put it aside. But I hear it the same thing with women too, because they're worried about the family and they have all of these other responsibilities. So why is it that somebody doesn't take care of themselves, like you said in that, and how can you change that pattern of behavior?
I think that's exactly right. And I think we do this in so many areas of our lives. But from a health perspective, I think we all need to take a personal assessment of where we are. Where are we with seeing the doctor and getting testing like you hadn't done for 10 years? Where are we with our exercise? Where are we with our diet? And I think you have to do that. No different than you would manage your retirement or you would manage your cars
Sure.
or your home. And I think we all need to do that regularly. You need to plan that. These days everybody's using their cell phone for appointments. Maybe once a month you need to reflect on where am I? And you mentioned men and women not taking care of themselves, and you're exactly right, because everything else comes first. It's family, it's work, it's social activities. But I think if you plan time for yourself, If you take 30 minutes a day to exercise, if you take that 10 minutes a day to make sure that you're eating healthy, you're not ordering takeout, maybe you're planning meals, you're thinking about what did the dietitian teach me about better health habits. It can be incredibly valuable to you in the long run. You'll have more energy. You'll have more opportunity to enjoy quality of life.
You talked about going on your cell phone, and our cell phones are with us all the time.
Yeah.
Mine is off, by the way, so make sure we don't get any errant calls. But the technology of medical interaction with medical experts has advanced exponentially. And then the pandemic, you hear about telehealth, and I'm sure you've done a lot of things with your patients on cell phones. And yet at the same time, does that make it less of an experience because you're not with the patient one-on-one? Yet at the same time, you don't want to spread virus and concerns. So that balance of technology versus one-on-one, how do you answer that?
And it's a really great point. And I think there is a cost to doing telehealth and doing video visits, but it also allows better access. I've interacted with people during the pandemic that are in other cities that are under my care that they would have ended up in an urgent care, maybe even an emergency department. So while I can't physically touch them, I can't physically examine them, I can interact with them, and I'm the one who knows their care the best. And I think what really it's done is every day I'm interacting with more of my patients directly. So, it would be that you call in and say, gosh, my big toe hurts. And the nurse would type me a note into the computer, and I'd answer it, and she'd give it. So it's kind of this back and forth, almost secondhand. But there are a certain number of people that I'm touching every day. You had a test and it's abnormal. What does this mean? What are your questions? What are next steps? So that it allows me, because now, again, we're pulled in so many different directions, but the insurers are supporting this as part of your care package.
Good.
And I think, it's no different than when portals came up in medical records. My patients touch me. They'll say, hey, doc, I'm going on a trip. What should I know? Should I be worried about traveler's diarrhea? Whatever it is, they can ask me more one-on-one. This is one more piece to that. Does it replace the one-on-one coming to your doctor? Absolutely not. But is it part of the game? Is it part of how you take care of your health? Because again, it's not really anymore. You mentioned early on about going and seeing patients at home, and I've done home visits and still do. Gave it up during the pandemic for reasons of health and wellness. But if you look at it, there's so many pieces of the healthcare system, whether they be testing, specialty care, all the social determinants. Do you have the right things at home? Do you have power? Do you have food? There's all these things you have to consider. So as a primary care provider, there are so many things to assess. This is just one more piece in what we do to help try to maintain your good health.
And it keeps connected. Let's talk about heart disease. It's just a number one killer, really. And how does that impact you as a physician to help people reverse the process?
Absolutely, and it has to be front of mind. So when you see a patient, you look at the vascular risks. You look at, again, the things that we have really talked extensively about today: lifestyle, exercise, diet. But then where are your numbers? What's your blood pressure? What's your sugar? What's your cholesterol? Do you smoke? What's your family history? Right. And then what are the symptoms that you warn? Men have different symptoms than women. And you might have a man who has classic chest pain, but a woman might have jaw pain or shortness of breath. So you need to bring to your doctor's attention things that are out of the ordinary. And that's another advantage of seeking care every year. Maybe it's that little thing. Maybe it's, I saw a gentleman this week in the office, as well as you and I appear, but we did an EKG on him because of his medical comorbidities, and he had an irregular heart rate called atrial fibrillation. Well, that will impact him because he'll need to be on the right blood thinners to prevent stroke, and he'll end up needing some cardiac testing and specialty evaluation with one of my colleagues who's an electrophysiologist. So the value of going and seeing a doctor regularly is not only can you reassess lifestyle, but you can also maybe find some things out that wouldn't be front of mind until they become a problem for you. So I think that's the critical nature. Whether it be in person, whether it be by portal, whether it be by televisit, interacting with your doctor is critical to kind of picking some of these subtleties up that might not be forward there without doing so.
We have about 3 minutes left, Doc, so we want to pick up on a bunch of things. Prediabetes, diabetes, can it be reversed, and how do you handle that when you are given that diagnosis?
Yeah, that is absolutely a great thing to think about. If you're pre-diabetic, there are so many things you can do with lifestyle. Exercise, diet. Our organization has a diabetic education program and pre-diabetic education program that's supported by the local insurers. We run virtual classes in that regard. Huge piece, because nutrition drives this.
Yep.
Weight loss drives this. What's your exercise routine? And then there's medical things. There's medications that you might consider. Even for someone who's markedly overweight, there may be some bariatric procedures. We can access that within the health system at Great Lakes Integrated Network. We have an amazing bariatric program both at ECMC and at Buffalo General. They're amazing. I send patients there all the time. I love interacting with these docs. Some of them are just so dynamic, and they change lives. You can actually some people kind of reverse diabetes with some of these procedures.
That's terrific to
It's
hear.
really awesome.
When you talk about being a physician, you're also a pharmacist. And talk about drug interaction, and you added to it some of the other pieces of the medical puzzle that are out there that might interact.
Well, absolutely, because again, we know that prescriptions are extremely valuable in managing all these complex medical problems, but they all interact. They interact with food, lifestyle, alcohol, for instance, and they interact with each other. So when you go to see your doctor, not only should you know what medications you're on and what doses you're on, but what supplements are you taking? Are you taking vitamin C? Maybe that could cause kidney stones. Are you taking vitamin D? Are you taking calcium? And maybe that interferes with absorption of another drug. So every time you go to see your doctor, you should make sure that your doctor knows every medication you're taking.
Whether it's even a vitamin or a homeopathic
Absolutely.
medicine.
And we have clinical pharmacists at our organization that will do medication assessments for our patients. They come up with great things, and it's really exciting to see how that can impact people. Maybe less medications, maybe different timing of medications, maybe different dosing of medications. Wow. But and when you see someone who's a diabetic, who's uncontrolled, that interacts with our clinical pharmacy team, and then they work with your provider and with you, and you see the numbers come down and then become controlled. It's so exciting as a provider because you know that you've made a difference in this person's life, and they feel better, and they're more active. It's awesome.
Well, you make people feel better, Doc, and just from being with you, I'm energized already. And General Physician PC, and what's nice about it, and you being the Chief Medical Officer, you really have that 30,000-foot overview to make sure that it's not just the primary care physician, but it's all of those specialties that are handled. And General Physician PC does that so well. Yeah,
we really do try to do that. And not only is it the colleagues I have that are subspecialists, it's the pharmacist, it's the dietitian program, it's our clinical navigating team, it's our post-acute program that we run, that we see people in some of the nursing homes and do home visits on our patients. But it's also all the other services in the health system. Radiology, other specialties that we don't have. It's just really awesome to be able to, again, it's that medical home. It's what is the clinical integration of your overall healthcare. And that's what Great Lakes Integrated Network does, and we're part of that. And it's exciting every day to know that if my patient needs something, I likely have access to it, and I can likely provide them a good experience and help improve and maintain their overall health.
Will you promise us that you'll be back on your Hometown Health Connection?
I've really enjoyed being with you. You've asked me some really great questions, and I hope this has been useful to patients, not only my patients, but the community in general, because what we should all be striving for is to help each of us be healthier every day.
Thanks, Dr. Richard Charles, General Physician, PC. I'm John DeSciullo in for Samantha Latchall. Remember, you can connect with the Chief Medical Officer for General Physician PC. Connect with Dr. Richard Charles. His offices are located at 1091 Main Street, Suite 301 in Buffalo, 705 Maple Road, Suite 300 in Williamsville, and 5959 Big Tree Road, Suite 102 in Orchard Park. Write this phone number down. Get a pen and paper. It's 716-248-1420 and online at gppconline.com. I'm John DeSciullo. Thanks for watching. Be safe and be well. A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.